Did you know that after the age of 70, some of the very tests doctors recommend can actually harm you more than help? Every year, millions of seniors line up for checkups believing they're protecting their health. But here's the shocking truth. New research shows that up to 37% of those medical tests lead to unnecessary treatments, risky surgeries, or even lifelong side effects. And the most alarming part? 99% of people over 70 don't realize they're being overtested. In this video, we're going to expose 5 common medical checkups that could quietly ruin your quality of life after 70. One of them is responsible for as many cancer cases as drinking alcohol every day. Another may push you toward brain surgery you never needed. And the one at number 2, you'll be shocked it's even on this list. Before we dive in, let us know in the comments where you're watching from, your age, and have you ever regretted a test or procedure? We'll be replying to every comment with personalized advice. And don't forget to like this video and subscribe for more life-changing health insights. Now let's begin. It sounds harmless, a quick scan of your bones. A bone density scan, known as a DEXA scan, is one of the most common checkups after 70. It's supposed to measure how strong your bones are and detect osteoporosis. But here's what no one tells you. Past 70, these scans almost always show lower bone density, even when there's no real danger. Bone loss is a natural part of aging, like gray hair or wrinkles. The result? Seniors are pushed into taking medications like bisphosphonates, drugs that are marketed as bone strengtheners, but that come with dangerous side effects: esophageal irritation, digestive problems, brittle bones that break in unusual ways, and even a rare but devastating condition called jaw necrosis, where the jawbone starts to die. Studies prove the risk outweighs the benefit. One large trial followed over 1,200 women above 70. Fracture risk went down by just 0.3% after 5 years of medication, but the side effects were far more common and life-altering. Take Rose, a 76-year-old retired piano teacher. She had no pain, no falls, walked daily. After a scan showed mild osteopenia, her doctor prescribed a bisphosphonate. Within 3 months, she developed severe reflux and jaw pain so intense she stopped playing piano. We stopped the medication, put her on vitamin D, weight-bearing exercises, and calcium-rich foods. A year later, she was stronger, more balanced, and had no fractures. The truth is, for people over 70 who haven't had fractures or falls, lifestyle is the safer, smarter option. Strength training, balance exercises, nutrition, and vitamin D can reduce fractures by 20% or more. Don't let a number on a screen scare you into dangerous treatments you don't need. When it comes to memory, fear drives decisions. Seniors notice more forgetfulness, and the fear of dementia or Alzheimer's is overwhelming. Doctors often respond by ordering a brain MRI. But here's the uncomfortable truth. MRIs rarely give the answers people are hoping for. In fact, in older adults, most MRIs show age-related changes, slight shrinkage or white matter spots that are totally normal. But once those spots are seen, fear sets in. Patients are told something is wrong. That leads to cascades of extra testing, spinal taps, invasive biopsies, even brain surgery, all for findings that often mean nothing. A major review found that 86% of seniors with mild cognitive complaints had abnormal MRI results, but only 3% were actually linked to a treatable condition. That means 97% went through fear, tests, and sometimes procedures for no real reason. Take George, a 74-year-old retired engineer. He misplaced his keys more often, forgot a few names. His doctor sent him for an MRI. The results showed white matter changes. He panicked, convinced he had dementia. He stopped driving, stopped socializing. His anxiety worsened. But cognitive testing showed he was normal for his age. With reassurance, sleep improvements, hydration, and brain exercises, his memory stabilized. The truth is, unless there are severe neurological symptoms, seizures, sudden changes in personality, or rapid decline, an MRI is rarely helpful for mild forgetfulness. A simple cognitive screening test on paper is cheaper, safer, and avoids unnecessary panic. Now let's talk about one of the most common heart tests, the cardiac stress test. It's used to check for blocked arteries, often with seniors who report fatigue, chest tightness, or just not feeling the same. But after 70, this test can do more harm than good, especially if there are no classic heart symptoms. Why? Because false positives are extremely common. Research shows that in seniors, stress tests can give false alarms up to 40% of the time. That means tens of thousands of older adults are told they might have dangerous blockages, when they don't. And the result? They're pushed into invasive follow-ups like angiograms and stents. A major JAMA cardiology study revealed that more than half of all stents placed after stress tests were in patients who didn't need them, with no improvement in survival or quality of life. What they did face were complications: bleeding, kidney injury from contrast dyes, extended hospital stays. Raymond, a 75-year-old retired postman, stayed active and walked every day. During a checkup, he mentioned feeling tired on hills. His doctor ordered a stress test. Results were unclear, so he was sent for a catheterization. A mild narrowing was found, and a stent was placed. That night, he had a severe reaction to the dye, developed kidney problems, and spent 6 days in the hospital. His fatigue never improved, because it wasn't his heart. It was dehydration and natural aging. If you're over 70 and don't have chest pain during activity, shortness of breath, or significant energy crashes, a stress test may do more harm than good. Safer options: a resting EKG or a coronary calcium scan, which uses low radiation and is far more accurate. And now, one you probably didn't expect: colonoscopy. Yes, colonoscopies are life-saving in the right age group, but after 70, the balance shifts. And after 75, routine colonoscopies are almost never recommended unless there are symptoms. The risks rise steeply with age. The prep itself, strong laxatives cause dehydration, dizziness, kidney issues. Sedation adds risks for memory, confusion, and even long-term cognitive problems. And the procedure can cause bleeding, tears, or heart rhythm disturbances. A study of 1.3 million Medicare patients found that for every 1,000 colonoscopies in patients over 75, only 2 lives were saved, but more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. And even when small polyps are found, they often grow so slowly in older adults that removing them can cause more harm than leaving them alone. Dana, a 73-year-old baker, had no symptoms, no family history, and 2 prior clean colonoscopies. But her new doctor urged another screening. During the procedure, a polyp was removed. That night, she collapsed with intense abdominal pain. A bowel perforation had occurred. She spent 9 days in recovery and was never quite the same. The truth? The U.S. Preventive Services Task Force recommends stopping routine colonoscopies at 75 for most people. A better, safer alternative? Stool-based tests like the FIT test, which you can do at home without sedation or risky prep and still catch most serious cases. Finally, the #1 checkup that may be more dangerous than any other: the annual full-body CT scan. Often marketed as part of luxury executive health packages, these scans promise early cancer detection. But the reality is shocking. A single full-body CT scan delivers as much radiation as 500 chest X-rays. And according to recent modeling studies, the rise in CT scans is now responsible for up to 5% of all cancers in the U.S., the same proportion caused by daily alcohol use. That means 1 in 20 cancers could be caused by the very scans that are advertised as preventive. Worse, the scans pick up harmless findings: tiny nodules, cysts, calcifications that are part of normal aging. But once they're spotted, fear sets in. Doctors order more scans, then biopsies, then surgeries, and sometimes the complications are worse than the original concern. Marcus, an active 80-year-old martial arts instructor, felt perfectly healthy. He agreed to a full-body scan at a private clinic. The scan showed a 3 mm lung nodule. He was sent for a PET scan, then a biopsy. The result? Benign. But the biopsy collapsed part of his lung. He spent 2 months recovering in the hospital, all for something that didn't need treatment. The American College of Radiology is clear: full-body CT scans should never be used in healthy, asymptomatic adults. If you have unexplained symptoms, weight loss, coughing blood, or severe pain, then targeted scans make sense. But scanning the entire body without reason is like searching for treasure with a landmine detector. You may find something, but the damage could be worse than what you were trying to avoid. So there you have it. 5 medical checkups that may sound protective but can actually harm you once you're past 70. Bone density scans, brain MRIs, stress tests, colonoscopies, and full-body CT scans. All common, all overused, and all riskier than you've been told. The message is simple. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Always ask your doctor, what happens next if this test finds something? Will the result truly change my treatment, or will it only lead to more tests, more fear, and more risks? Real prevention is not about fear-driven testing. It's about lifestyle, staying active, eating well, sleeping deeply, and maintaining social connections. That's what protects your health after 70, not endless scans and invasive procedures. Now we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out unnecessary? What happened? Share your story in the comments. We'd love to hear it. And if this video opened your eyes, hit like, subscribe, and share it with someone you care about. Because knowing which tests to avoid could save not just money and time, but your quality of life.